What's up guys, Tony Maritato here. So in this video, I want to share one of my favorite ways to use the rangemaster pulley system to establish and create some glenohumeral traction. Traction is essentially when we're kind of pulling the joint gently, creating a little bit of space between the joint surfaces. If you've been in physical therapy before, either after a surgery or just for a painful shoulder, oftentimes the therapist will have you lay on the table, they'll grab your hand or wrist, they'll create a little bit of traction and what we call a little bit of oscillation, right? And so the idea is we're creating a suction, a vacuum effect inside the glenohumeral joint, inside the shoulder. That suction creates space between the joint surface, but also draws some of the synovial fluid in, and then when you reduce or release the traction, it kind of squishes back out, so it facilitates that fluid exchange. Let me just show you how to do it with the pulley system. Usually what I'll do is I'll take it, I'll put it down, kind of more in a horizontal position. I'll set the handles. Now I'm gonna shorten this one up just because I'll be off camera if I don't. But we want a little bit of length. Anywhere over like 12, 15, 24 inches is great. I'll put two handles in one hand if this is the shoulder that I want to create the distraction on. And then as I relax, I'm resting the shoulder. The shoulder is totally loose. You guys have seen, I'm sure, patients doing pendulums, right? Think of this like a pendulum. It's in my hand, my shoulder is totally relaxed. It's dangling, it's hanging. And so the way I do it, I usually do three positions. I'll do facing forward. So the center of my body is lined up with the line of the pulley. And then I'll just do a little back and forth oscillation. It's just like a grandfather clock ticking off time. I'll do about 20 or 30 in this position. And then what I'll do is I'll bring it across. So now it's pulling me across the front of my body. It's giving me a little posterior capsule stretch, very gentle. And I'll do a little up and down oscillation. So my bicep and tricep are working. About 20 to 30 of these. And then I'll go ahead and turn. Forgive me for turning my back. But I'll turn so it's pulling out into abduction. This is away from the body. This is usually the most aggressive, the most uncomfortable. So if it's painful, back it off. But from this position, now again, I'll allow it thumb up position to just give me this oscillation, pendulum motion side to side. The important thing here is I'm not pulling against the pulley. I'm allowing the pulley to pull my arm. That is what creates the space. That's what opens up the joint capsule just a little bit. And that's what helps to bring the nutrients, the synovial fluid, over the joint surface. So guys, talk to your physical therapist about these exercises. If they have not been specifically prescribed for you, for your condition, don't do them. But if your physical therapist has prescribed this video, then absolutely give it a shot. I'll usually do this 20 to 30 repetitions in all three positions. I'll do it 3 times a day because what I want is I want these micro exposures. I want about a minute of activity happening in the joint and then an hour or 2 of rest. So repeated tiny exposures. We're not trying to build strength. We're not trying to break down muscle tissue. We're trying to affect a chemical change inside the shoulder joint. And if you want to know more about what that means, I'll create a separate video for that. But we're literally changing the chemistry inside the shoulder. Guys, as always, thank you so much for watching. I'll catch you on the next video.